Hi, I'm Dr. Daniel Egan, an emergency department physician at St. Luke's Roosevelt Hospital in Manhattan. Thank you for using the AIDS Institute widget on your desktop to learn about PEP, HIV testing, and acute HIV infection. In this podcast, I'm going to talk about non-occupational post-exposure prophylaxis, or npep. We use npep to treat potential sexual, drug use, or other exposures to HIV. The timely administration of a 28-day course of npep can effectively prevent HIV infection in people who may have been exposed to HIV. Remember, evaluating your npep patient for exposures to hepatitis B and C is essential too. So after viewing this podcast, open icon 6 for the AIDS Institute guideline on evaluating exposures to hepatitis B and C. If a patient presents to your emergency department or urgent care facility describing a potential exposure to HIV infection, either through a sexual or drug route, including sexual assault, here's what you need to do to assess and implement PEP. First, treat the presenting patient at triage with the highest priority, as timely implementation of PEP is crucial to its success. If you have a triage system, educate your triage nurses that these patients should be prioritized similarly to other critical medical emergencies. Second, promptly offer your patient the first dose of antiretroviral medication before continuing your evaluation. We advocate taking the first dose quickly, as there are few negative consequences associated with taking just one dose of antiretroviral drugs, and research demonstrates that PEP is most effective when taken closest to potential HIV exposures, ideally within 2 hours. New York State guidelines recommend that patients initiate PEP within 36 hours of a potential HIV exposure. If a patient presents outside this time period, we recommend that you call the 24/7 New York State PEP line for guidance on individual cases at 888-448-4911. PEP line calls are answered immediately or within 5 minutes. Next, evaluate the patient's potential exposure to determine if PEP is necessary. Types of exposures that should prompt consideration of npep are unprotected, receptive, and insertive vaginal or anal intercourse with a source that is HIV infected or whose HIV status is unknown. Unprotected, receptive, penile oral contact with ejaculation with a source that is HIV infected or whose HIV status is unknown. Oral vaginal contact with blood exposure. Sharing needles or drug paraphernalia with a source known to be HIV infected or whose HIV status is unknown. Injuries with exposure to blood from a source known to be HIV infected or whose HIV status is unknown, including needle sticks, human bites, accidents. Types of exposure that do not warrant npep are kissing, oral-to-oral contact such as mouth-to-mouth resuscitation where there is no mucosal damage, human bites where the biter and the person bitten do not shed blood, exposure to solid bore needles or sharps not in recent contact with blood, mutual masturbation without skin breakdown or blood exposure, oral anal contact without blood exposure, receptive penile oral contact without ejaculation, insertive penile oral contact without blood exposure, oral vaginal contact without blood exposure. You may find exceptions to these guidelines. For example, a patient may report that while his or her partner did not ejaculate, he did have a lot of pre-ejaculatory fluid. PEP may be advisable in such a circumstance. For such cases, and others when you need help determining whether PEP is warranted, please call the 24/7 New York State PEP line at 888-448-4911. If the presenting patient describes a potential HIV risk exposure, ask the patient if he or she knows the HIV status of their partner. If your patient tells you that his or her partner is HIV positive, or that he or she does not know the partner's HIV status, recommend that the patient complete a 28-day course of PEP. What drugs to use? For persons 13 years or older, the New York State AIDS Institute guidelines recommend 2 options. Option 1. 300 milligrams of zidovudine with 150 milligrams of lamivudine, both twice daily. Or one could give Combivir, which is a co-formulation of these drugs and is dosed 1 tablet twice daily, plus 300 milligrams of tenofovir once daily. Option 2. 300 milligrams of tenofovir once daily with 200 milligrams of emcitriptyline once daily. Or one could give Truvada, which is a co-formulation of these drugs and is dosed 1 tablet once daily, plus 300 milligrams of zidovudine twice daily. Alternative drug regimens. If you learn that the source of the exposure is resistant to any of the recommended PEP medications, or if the exposed patient is pregnant, breastfeeding, has anemia, kidney, and/or liver disease, consult the 24/7 PEP line at 888-448-4911 for guidance on alternative PEP regimens. A PEP line expert will respond immediately to your inquiry, and your patient will not experience a significant delay in starting PEP. If you learn that the person who is the source of the exposure harbors some drug resistance, do not delay PEP while waiting to obtain information on the source of the exposure's antiretroviral resistance, unless the exposed patient cannot take the recommended antiretroviral regimen for other reasons. You can always change the drugs if lab findings indicate that the source of the exposure is resistant to the drugs you prescribed. Next, give the exposed patient an HIV test to rule out pre-existing HIV infection. Currently, New York State requires separate consent for HIV testing. Download these forms from icon 7 inside this widget. If the patient's HIV antibody test is positive, do not stop PEP until you have obtained a confirmatory test result called a Western blot, because in rare cases, some HIV antibody tests can be falsely positive. Also, try to learn the HIV status of the source of the exposure. If the source of the exposure is known to be HIV positive, find out information regarding the patient's most recent CD4 count, latest viral load, any use of antiretrovirals past or current, and evidence of drug resistance. If data from the source of the exposure indicates drug resistance, consult an HIV PEP specialist at the 24/7 New York State PEP hotline at 888-448-4911. Do not delay PEP while awaiting evaluation, as PEP regimens can be adjusted at a later time. If you learn that the source person has HIV infection, or you do not know, and cannot learn the HIV status of the source person, recommend that your patient remain on PEP for 28 days. Two common side effects of PEP are nausea and diarrhea. In the event of nausea, 10 milligrams of metoclopramide can be given 30 minutes prior to taking the meds. And for diarrhea, 2 milligrams of loperamide or Imodium can be given up to 4 times a day. These drugs may help patients adhere to the 28-day course of PEP. Follow-up care. Arrange follow-up care with an experienced clinician within 72 hours of starting your patient on PEP. Make sure that your patient has enough medications to last until their first appointment for follow-up care. Many emergency departments dispense a PEP kit, which includes the first 3 days of medications, allowing time for the patient to arrange follow-up care for the next business day. Obtaining antiretroviral medications for npep. Private insurance, Medicaid, Medicare, and workman's comp insurance will all cover the costs of post-exposure prophylaxis medications. Facilities serving persons lacking health insurance will have to either cover these costs, ask the patient to cover them, or seek programs which offer PEP. Do not send uninsured patients to other facilities if they lack insurance. Evaluate and treat these patients regardless of insurance status. You will have time to try and locate coverage for medications after the patient has been started on PEP. Open icon 7 for the link to victims assistance programs that can connect you quickly to this service. Stocking PEP medications. We advise all emergency departments, clinics, and urgent care facilities to have on hand packets containing the New York State recommended antiretroviral drugs for the first 3 days of PEP. Ready access to antiretroviral medications will greatly enhance the speed at which patients can begin PEP. To obtain on-site training for your staff on implementing routine HIV screening, post-exposure prophylaxis, and acute HIV infection, please contact the AIDS Institute's Center for HIV Testing, Post-Exposure Prophylaxis, and Acute HIV Infection at 212-604-2980.